He conquered cancer but almost died due to fulminant hepatitis outbreak. Hello, I'm Dr. Yu Yucha. Welcome, Professor Wang Chengfeng, to Care Online. Hello, I'm Dr. Huang Chengfeng from the Division of Hepatobiliary and Pancreatic Medicine at Kaohsiung Medical University Hospital. If a patient with hepatitis B needs to undergo chemotherapy, how should their hepatitis B be managed during this period? Many cancer patients also have hepatitis B, principally according to the prevalence rate in Taiwan, assuming it is the generation before vaccination, which means adults over 40 years old currently. Maybe 1 out of 10 cancer patients has hepatitis B. Therefore, hepatitis B patients undergoing chemotherapy are at risk of virus reactivation due to immunosuppression, leading to acute hepatitis or even fulminant hepatitis and liver failure. Hence, all patients requiring chemotherapy, if they are hepatitis B carriers, should start oral antiviral therapy within 7 days before chemotherapy initiation to prevent hepatitis B reactivation during chemotherapy, regardless of whether they are active or inactive carriers. As long as they receive chemotherapy drugs, there is a risk of immunosuppression and virus reactivation. Therefore, under Taiwan's national health insurance, all patients undergoing chemotherapy can start taking oral antiviral medication within 7 days before the start of chemotherapy and continue until the end of chemotherapy. They can then take the medication for an additional 6 months as consolidation therapy to prevent hepatitis B reactivation in hepatitis B patients during chemotherapy. If undergoing organ transplantation, how should hepatitis B be managed? After organ transplantation, long-term use of immunosuppressive drugs is necessary, which may lead to hepatitis B reactivation due to immunosuppression, even causing acute hepatitis, meaning that despite the successful organ transplantation, the patient may unfortunately die from fulminant hepatitis or acute hepatitis. Therefore, any transplantation except for corneal transplantation, any hepatitis B patient undergoing solid organ transplantation must receive lifelong antiviral therapy, which can begin within 7 days before transplantation. Organ transplantation can be broadly categorized into 2 types. One is liver transplantation. The other is non-liver organ transplantation, such as heart, lung, pancreas, kidney, etc. What's especially different is that, if a hepatitis B patient undergoes liver transplantation, in addition to lifelong antiviral therapy, which is more convenient and has fewer side effects, some patients may still experience hepatitis B reactivation, despite receiving antiviral therapy. So if the donated organ is the liver, in addition to oral antiviral therapy, immunoglobulin injections are also administered. The prescription varies among transplant teams, but generally, within the first 6 months to a year after transplantation, frequent immunoglobulin injections are administered to increase hepatitis B antibody levels, and depending on the situation, additional injections may be given if antibody levels decrease. This is the difference between liver transplantation and other organ transplantations. If accepting steroids or immunosuppressive agents for treatment, how should hepatitis B be managed? Regardless of whether they are rheumatology patients or special cases, they must use steroids or immunomodulatory drugs to control their original condition. Both types of drugs may suppress the immune system, leading to hepatitis B activation during treatment. This can be broadly categorized into 2 scenarios: patients using steroids, if using moderate to high doses for a prolonged period, may easily cause immunosuppression and virus activation. So antiviral therapy should be considered to prevent flare-ups. The other is immunosuppressive drugs. There are various immunosuppressive drugs available now, and their risk of hepatitis B activation varies. Therefore, all patients receiving immunosuppressive therapy must be monitored for hepatitis B activation. Taiwan's national health insurance has partially opened since March 1st last year, so whether using steroids or immunosuppressive agents, both can be managed preventatively or correctively by providing patients with national health insurance resources for antiviral therapy. Therefore, patients using steroids or immunosuppressive agents should consult with a hepatologist before use to assess if they are already in a high-risk group, and to monitor liver function and virus activity during treatment. And in case of unexplained elevation in liver function during treatment, consider hepatitis B reactivation as a possibility and take immediate action or referral. If there's an unexplained increase in liver function during treatment, apart from considering drug-induced liver dysfunction, hepatitis B reactivation should be considered first, and immediate referral or treatment should be initiated. There was a patient, a middle-aged man in his 40s, who developed lymphoma during his lifetime. At first, he was very depressed, but some patients responded well to chemotherapy for lymphoma, and after receiving a fixed regimen from the hematologist, his lymphoma was completely remitted, meaning he conquered cancer, overcame cancer, as we know. Due to immunosuppression before chemotherapy, the National Health Insurance provides hepatitis B patients with antiviral therapy before chemotherapy. This patient initially received antiviral therapy in the hematology department, and it was crucial that after the chemotherapy regimen was completed, the National Health Insurance would provide another 6 months of consolidation therapy to prevent hepatitis B reactivation after chemotherapy, as some patients might forget about their hepatitis B after successful chemotherapy. This patient, after successful chemotherapy, felt very relieved and forgot about having hepatitis B. So he didn't take the antiviral therapy for hepatitis B, and came to my clinic after about 3 months, with acute hepatitis, fulminant hepatitis, jaundice, and liver function showing GPT levels around 2000, indicating fulminant hepatitis in the patient himself. And when the virus level was checked, it was already over 100 million. So he conquered cancer, but almost died due to fulminant hepatitis. After antiviral therapy was administered again, the virus was suppressed, and liver function gradually recovered. From then on, this patient followed medical advice and was monitored and controlled for both conditions in both the hepatology and hematology departments. Thank you, Dr. Huang, for joining us at Care Online. See you next time. Goodbye.